Go ahead. You go. You're good.
Hello, All-Star clients, and welcome to another episode of the Veterinary Roundtable presented by All-Star Veterinary Clinic. For our new listeners, let's break down the format of the Veterinary Roundtable.
First, we're going to introduce you to our wonderful guests. Second, we'll break the ice with a few icebreakers, regardless of how well we know the guests on each episode. Third, we'll jump into case collections, where each of us will share an interesting case we've recently encountered. And lastly, client questions, where we'll try our hardest to answer a question or concern from one of our clients.
Wow.
Okay, so
Sounds
there you
very
have it.
repetitive. Like every time we do this. Oh, Harrison.
On today's episode, we have co-host and associate veterinarian,
Me?
the bomb, Dr. Ashlyn Duckwall.
Ashlyn Duckwall.
The Ashlyn Duckwall. It needs to be coming like an echo. There you go. We have Harrison is listed as dental expert.
Ooh.
No.
I knew she'd say that.
I was like, I read that and I was like, absolutely not. You could say like a dental enthusiast.
That's a great way to describe it.
Right? I would say I'm not qualified.
With
as a dental
years
expert.
and years.
Yeah. I think years of experience makes you
of experience.
An enthusiast.
An enthusiast. It makes you a fantastic, educated enthusiast.
Diehard fan of teeth.
Yes. That's better than expert.
Dr. Carla Cloud. And then we have Dr. Lauren Schmoke.
Hello.
She's a newbie, but is learning quickly
Yeah. Couldn't even tell.
because,
Couldn't tell she's
yeah,
right?
exactly.
killing it.
Another dental guru here at the practice. And then myself.
Co-founder and head veterinarian, Dr. Emily Mary King.
You're such a dork. Okay, so how's it? Carla, also, we should mention, traveled in.
Yes. Oh my gosh. We thought
With
she was
her
going to
two
be
chillins.
MIA. Yeah.
Yeah. So thank you for coming in.
Oh, you're welcome. They really wanted it was Ralphie and Randy that got me in.
They got you in. The two cats.
The kids wanted to see the cats.
Yeah.
Yeah.
So
Well, thanks for coming in on your
Yeah.
day off.
no problem.
And Schmoke, you've been stuck here, so
Yeah.
but thanks for being here and staying
Yeah.
late.
Thanks for staying. Yeah.
So
You
yeah.
should be thanking
Happy to
people
be
more
here.
often. Thank you for being
Thank
here.
you.
Oh my gosh.
I mean, you're awesome.
Wow. You're just
Okay.
great. Okay.
But we're also very hungry, so we'll move along.
Yes. Yes.
Okay. Icebreakers.
Mm-hmm.
What is your worst dating story? Schmoke.
Oh, okay.
Hot seat.
I was actually talking to my husband about this last night, and I had a lot of options.
Oh, you did? Oh,
And
no.
he told me I couldn't say a couple of them. So I'm
good
down
to run it
my
by him.
last one. It's for a different time. Anyways, went to the movies. That was our date. And I forget what movie it was, but it was very busy. We walk in like last minute, and it's so packed that we ended up sitting separate. And he was totally fine with it.
See you later.
Yeah.
Oh my
See you
God.
at the show.
Yeah.
Oh my God, that's
It was
hilarious.
so bad.
So you watched the movie separately,
I watched the movie by myself.
and you said when you got done with that movie, "So help me if you ever."
Now we order like seats.
Yeah, there you go. That's a
There you
Harrison
go.
thing. Harrison
Yeah.
is always like, "I got us tickets." Like, you know, now that's a thing. Back when we were growing up, that was never a thing.
No,
Yeah.
you just go.
You just went and you
Yeah.
just picked. You just got there early, or
And there weren't reclining seats either.
There
You
were not.
like,
Or you can't have dinner
yes,
and a
they were
drink.
all
no,
sticky.
there was none of that. There
Oh,
was
yeah,
just
no,
stale popcorn
popcorn.
and
Although the
Hot.
last 2 times
Yeah.
I've gone to the movies, there's been no one there to collect the tickets. You could just walk right in.
really.
Oh, so why even buy a ticket?
That's a question.
Always
thought.
buy a ticket. Don't do. I mean,
Always support
no.
your local theater.
Yeah.
Don't listen to Carla. Although Johnny went to the movies, I don't remember when it was, and they went to an R movie, and so I don't remember. Do you know what movie that was, Harrison? I don't know. And they weren't supposed to be able to go, but they just went. They just bought tickets for another movie and then went to that movie.
Yeah. Because you can just go in the hallway and you've got all the selections in
right.
the world.
Yeah, exactly. So there
So
was
what was
nobody
the
watching.
movie?
I don't remember what it was.
Oh.
I think maybe Beauty and the Beast. It's been a while.
Oh, it's even the cute one.
Yeah. It's fine. We kept
Still got
dating.
married.
We got
Kept dating, you got married. That's okay. It's
Give it
water
a
under the
second
bridge.
chance.
Yeah. Lots of
Okay.
second chances.
Carla, what about you?
Okay, I didn't know that we were having questions. I would say this would be all my dating experiences before I met Todd.
Okay, there you go.
That's a good
Kudos
one.
to Todd.
Oh,
Kudos to
Very
Todd.
good.
that's a good one.
He's
Well,
a
thank
great
you for that.
Mine would be with Richie when I went on my first date with Richie. It was raining and hot. We were in Tennessee, and he had this Toyota pickup truck that was like one of those smaller like pickup trucks, like the mini ones that like aren't even supposed to be a truck, but they make them into a truck kind of truck. And so it had no air conditioning, and it was raining. And so the windows were fogging up and everything. We had to go to an ATM. Okay. And so he tried to get money out, couldn't get money out. He had no money. And so I had to pay for the date. I was like, this is going nowhere. Meanwhile, back at the ranch. We're married with 5 kids. Okay.
5 kids in a business.
Exactly.
Wow.
What about you, Doug?
Mine was when Charles and he planned this trip to Indiana Beach, and we go down there, and we get there, and first we stay in this place that, I'm not kidding, gave me the heebie-jeebies. I was like, there had to be a murder here, right? This is creepy. So I was like, okay, but it's fine. We'll have fun. And then most of the water slides and everything were not working. They were down. Nothing was working. And we go to Indiana Beach for the water slides and stuff. So we left. We just left. We ended up going up to Michigan.
Oh my gosh.
Drove 3 hours up north. Ended up being great because we stayed at his uncle's, not cabin, but little lake house thing up there. But at first it was looking very grim. Nothing was working when you get there.
You're like, there's not more than corn.
Yeah.
In Indiana.
Was it when it was like going out of business?
Yeah, that's what I was going to say. Is like,
it was like in a weird period. Is it still open? Do they still have that?
Did they reopen it? I
honestly
don't know if they reopened it or not because they closed it, right? They sold it.
Yeah.
And then I don't know if it ever reopened or not. I can't remember.
I think it was very much open and not sold, just very broken. Because nothing was
Very
working.
broken.
Yeah, very broken.
It was right before it got sold.
Something like that.
Okay, question number 2.
If you had to be one body part, what would it be and why? Cloud.
One body part? I would say... wouldn't. Can I answer with what I wouldn't want to be? Is that
Sure.
Why not?
Questions. I would say not the nose. Like if I could not be a nose, like because sometimes things smell gross.
Yeah, it's true.
And it makes you feel like
Make you spiral into a whole bunch of feelings.
yes, I would not want to be a nose.
Okay.
There.
Okay. Okay, smoke.
I would say, can I say taste buds?
Sure.
Oh.
Okay.
Food, wine, sweets.
Yeah.
That's probably what I would be.
Okay.
That's a good one.
You like all of that?
Uh-huh.
So you just don't buy it so that you don't eat it? Because you don't look like you eat
No,
it.
I eat it.
You're like, yeah, I'm still young enough. I can eat all of it. I eat all of it. As a matter of fact, when I go home tonight. Gosh, I would. What are you thinking I would say? Because you're looking at it as
I
if
don't
you
know.
what I would say.
I don't know. I feel like yours would be very off the cuff. Mine's, I think, off the cuff.
I would say mine would be my neck because I control the head.
I was going to say thumbs.
Oh, thumbs! That would have been good too.
You can't do anything without these guys.
You cannot do
thumbs
anything
all
without
the
your
time.
thumbs. You're right. Exactly.
That was interesting. That was an interesting question.
Very interesting
I was
question.
not expecting that.
So,
Wow, we're moving through nicely.
case collections.
Mm-hmm.
Did you find that picture, Harrison Branch? Can you find a picture, please, of the
I love how you use
interesting
the middle name.
case? What?
He's in trouble. Use the middle name. Right? Branch?
Yep. Mm-hmm.
Mm-hmm.
Which, now that we're coming into March Madness, down there at the bottom on your list, see that? Yeah. Put dog. Oh. Yeah.
Oh.
Okay, pick. Oh, yeah.
Oh,
pick that
how?
second one in from the don't you think? That's a pretty good. Okay. All right.
Is that what your dog
Go
looks like?
Schmokies.
Yes.
Okay, go Smokes. You explain the case.
What?
please. Smoke and I picked the same case. Okay.
So I had a
Yeah.
7-month-old female golden retriever come in and doing great, except it has like bug eyes.
Like the picture
and
on
it
screen.
it looks like this picture that will show you.
Aw.
But acting great, no other issues, but its eyes were like bulging out of its head. And the weirdest part was that the whites of the dog's eyes were also like really swollen and puffy, like looked like marshmallow. It was so weird. So I went and found Dr. King. It's like, this has to be something specific.
I went and found Dr. King. How did I diagnose this patient? I went and found
probably
Dr. King.
seen something.
You
like
already
it.
were figuring it out. Yes.
And she knew what it was. You've seen it one time before?
I'd seen it one other time before.
I guess
You
it's
really
very
can't
rare.
forget that.
Nope.
I mean,
No.
Because it was hard to figure out because I was in the boat that she was in trying to figure it out. And you're like, okay, my pressures are normal. There was no stain uptake.
Right.
And then it was a retriever.
Yeah,
that was
and
the
it
other
was
clue. That was a
both.
retriever.
Yeah.
Okay.
Both eyes.
So it would like retrobulbar, like you could like push it.
Yeah. So
So you
it's
would like not think of mass or.
yeah. You could push them back.
And yeah, it's usually in young.
Yeah, usually there's certain breeds that it's common in. Golden Retrievers are one, Labs are one, Dobermans. There's a couple others, but usually less than a year of age, healthy, no other issues, and it's very acute. Comes on, and owners will bring dogs in.
Because
Usually
they look
within a
like
week.
that.
Yeah.
Yeah.
Hey, my dog went from this to this.
Yeah, I mean, it looks like those. Yeah, it's just wrong looking.
Aw.
But-
Do they get dry eye? Like because their bulbs are like sticking out? Are they really sticking out, or are they just
Yeah.
they are protruding?
Yeah.
What?
Huh.
Yeah, it's really
So, like,
because it's
how do
really
they blink?
exophthalmia, not big globes. It's like they're being shoved out of the
Yeah.
socket
So how do
because
their lids close over?
their muscles are all swollen and inflamed.
Wow.
Yeah.
So
This dog could still blink, but yeah, it's swelling of the muscles that control the eye because it's an immune-mediated disease.
Oh.
And then the treatment is to start immunosuppressive steroids, and they respond pretty quickly, like within a week.
And you just take them off of it then eventually? Or is it like a chronic thing? It flares up every once in a while? Like,
Yeah, you taper off of it slowly so it doesn't come back, and then usually they're good.
oh,
Can
okay.
come back, but
And there's no, so it's autoimmune. So it's not like some of those diseases where some things can cause the, you know what I'm talking about, triggering it. So there's it just randomly.
no, this is just it's idiopathic.
happens,
It's just
yeah.
bizarre.
Wow.
Yeah, I saw it in one other golden retriever, and I didn't, of course, know what it was, and so then I was like venting everything. I'm like, big eyeballs, like like you're like, okay, eyeballs coming out of the head, golden retriever,
Shih Tzu eyes and a golden retriever.
right? Exactly. And it's very, and so it's just one of those things. Now that you guys have seen it,
Yeah, never forget that.
you'll never
Yeah.
forget it.
yeah.
Actually, I will. I'll be like, remember that one time?
One thing, and that's
Saw
what
that
that's what I
dog?
did to her. I was like, "It's something. Hold on a second. I know what it is. I know what it is."
I treated
Wow.
it. I can't something.
Yeah, exactly. It's a cool case.
Did you put it on the zebra wall?
We did.
Yeah, we did. It was my first one.
I was
on
going to
Zebra
say your
Wall.
first one.
Yeah.
Wow. We should
I
have
know.
like another, like a bell or something when we add something.
Oh, we could have like a
Yeah.
ringer at the top of the
Yes.
thing. That would be
Dudley
awesome.
just added one today too.
Yeah, we needed
So
to be
they
like,
just
we
keep
need to ring
coming.
that sucker and then
Yep.
put a buck in or something.
Hey, I got you a bell that says ring for beer.
Oh, we'll just bring that in there.
Just-
People will be like, "Oh yeah, there's another bad case." All the staff will be like, "Oh, there goes another one."
yeah. Yeah.
So anyway, that was my case too. That was the one I was like, "Oh, super excited."
Yeah, that's very, very interesting.
Yeah.
it's
that's
kind of
good to
cool, and it
keep in
looks kind of
mind.
cool, and it's cool because you fix them right away.
I didn't know it was a thing.
Yeah, it's
I didn't
fascinating.
either.
Yeah.
Okay.
And I think it's so interesting that you can see something like that and you may not see another one for however many years.
Yeah.
And then you might not, you know what I mean? Like over the
Right.
course of like, cause I'm old, like, so I'm like, however
You're a
many years.
spring chicken. Oh, stop it.
Repeating your difficult cases now?
Yeah, exactly. Like 26 years, I've seen that twice
yeah, that's
in 26 years.
also good perspective for
so
sure.
it's not very, it's not like a common thing, but
Yeah.
it's, anyway, interesting.
Wow. Wow. Okay.
Carla, what about you?
Carla?
Well, I did think about this. I asked Harrison, I was like, do I need to have a case? And he was like, maybe. I thought it kind of tied into like what our question later would be. But
Sure.
It was actually Becca's parents' dog, Moose.
Mm-hmm.
He came in for just like a routine dental and a mask removal. And there was like this really weird little notch in one of his canines. And it was just in the enamel. And you really wouldn't think it didn't look like anything. It was just like a weird little nick on it. And then on x-ray, I thought, well, maybe it's starting to abscess, but I don't know. It wasn't really definitive. And then when we cleaned it, it was really painful for him, like under anesthesia. Like every time he touched that spot, like his heart rate would go up. So we ended up extracting the tooth. And then Becca said that he's eating better than he's ever eaten his entire life.
Oh my gosh.
Too.
So it was
just
really
like a weird,
painful.
Yeah. And you would like not have known, you know.
Yeah, because he's is he a lab? A
He's-
golden retriever lab or lab or
he's
something?
like a lab pity mix, something.
I mean,
like
so they're
that.
food driven. So he probably still was able to like persevere and eat
Yeah,
something.
and
So maybe
eat.
then people are like, oh, you know, they're still eating.
Yeah.
But then when you
through
fix it, you can see that they really are happy
Wow.
about eating.
Yeah.
Was it like the enamel was chipped enough to get just to the pulp cavity, or it's like a separate?
It was
okay.
like just barely through the enamel. So it must
Wow.
have been enough to expose some like dentin and stuff underneath to let it get through. But it wasn't like the crown tip. It was just like in the center of the tooth, like something, and maybe hit it and chipped it that way.
Oh, chipped it that way. Oh,
So
fascinating.
interesting.
Yeah.
It's weird.
He fixed
Glad
it.
we're talking about dentals because they are important.
Yes,
Yeah.
they are.
Hence the
Yeah.
reason.
What's your case?
I was waffling through a couple, but I decided on this really sweet older Cavalier. She came in to me one time for, I had seen her for other things, but came in for just like recent kind of gagging, hacking. So kind of going through the most common things of, you know, is it tracheobronchitis? Is it esophagitis? You know, something like that. And we kind of walked through, is it GI or respiratory? So went through some supportive care through that. And she responded really well. And one of those supportive care things was an oral anti-inflammatory. So once we got her off of it, it was there, but not as prominent, but it still kept happening. And then there was something like, she kind of had a decreased appetite. So we investigated with chest x-rays because I was like, well, let's just start looking. And we included the throat. And unfortunately, in the chest x-rays, we saw some masses in her lungs. So the way they looked, they were small. We're like, I'm really concerned this is coming from somewhere else. But we talked about options of further investigating where we want to go from there. So they decided to pursue it with an oncologist. And while they were intubating to get ready to do samples of lung mass, they actually saw back in her tonsils, she had masses on the back of her tonsils. And so by that, the oncologist knew, well, it's probably squamous cell carcinoma of the tonsils, and it loves to go to the lungs. It's fairly aggressive with the metastasis too. So it kind of all tied together there. But it did explain her kind of like weird gagging. And the other thing is interesting because it does respond best to an anti-inflammatory for like palliative care. So that's why she probably got a little better too. But they did pursue chemotherapy. So she's still doing that right now and hanging in there from what I've heard. So
How old is she?
12 or 13. It's
Oh, wow.
Clarice.
Okay.
Yeah.
Oh, it's Clarice Robinson. Oh, I love Judy
I
Robinson.
know. They're fantastic.
And
And
Carly's the daughter.
yeah, they're
yeah,
amazing.
yeah.
Yeah. So once I saw, you know, one thing led to another, but yeah, so they're going through chemo and hopefully keep her comfortable.
Where is she doing chemo?
She's at VCA. I had to
Okay.
think about that. She's at VCA.
Yeah.
I was like,
Oh,
let me
good.
think about it.
Okay.
Mhm. But they got her in quickly and they got things rolling, and they actually sent pictures too of the tonsils. So that was helpful because I've looked in her mouth, but you can't,
Yeah.
when they're
See
awake,
back
there's no
there.
way.
Yeah.
So yeah,
Fascinating.
it is fascinating.
Yeah. They're a great family.
They're amazing. Yeah. And she's so cute. Oh my gosh. Or overbite. She's like, the
I know,
cutest
she's so
puppy
bad.
I've
I
ever
remember when
seen.
they got her as a puppy.
Oh,
Because she's been coming since she was a puppy because they had a golden retriever that they had lost. I had met them because we saw them on emergency for their dog had a hemangiosarcoma. Basically, it was bleeding out.
yeah.
And so, and then they got Buster and Clarice, you know, as, you know, two other dogs, the
Buster's
next
great,
set
too.
of dogs or whatever.
Yeah.
Yeah. So,
Great people.
yeah, she's a neat person. She's an OBGYN and works with people that, you know, she works downtown and works in some facilities where people don't have medical care.
Okay.
So
I didn't know
it's
that.
really
That's
neat.
cool.
Yeah. She's a really neat person.
Yeah.
Anyway, a little bit about Judy Robinson.
Yeah. So fingers crossed for Clarice. Good vibes going our way.
Yeah. Very cool.
Yeah.
So on to the topic of the week, which is dentistry, which is why we have the two enthusiasts.
That's right.
AKA experts, not experts. Okay.
That's right.
So our question comes from Becky. And Becky, I can never figure out the correct way to say her name. So Becky has been a client forever. And she has always listened to the podcast. And she's had 2 dogs. This is Keebler's her second dog. Anyway, so it comes from Becky Shewmake.
It looks like Shewmake.
Shewmake.
Is it not Shewmake? That's how I would.
Shewmake. Okay, we're going with that.
I don't know. Hey, Becky. Just listening.
So how can one tell if an elderly dog is having teeth sensitivity, and what, in your opinion, is the best treat for elderly dogs with possible dental sensitivity?
This is a great question.
And she has an
This is
elderly
great.
dog. I mean, she's elderly.
Yeah. Like the dog?
Yeah.
You know the dog's
Yeah.
very elderly. Okay.
Yeah.
Okay.
Fragile.
Who wants to start?
I'm just kidding. She's
Wanna
really
start?
sweet.
Sure, I'll start and then we can fill in.
Okay.
That's a good question. I think that's a tricky question because there can definitely be obvious signs, but then sometimes dogs won't show any signs and they could have sensitivity in the mouth. So the more obvious signs would be like chattering. You're looking at your dog's mouth or trying to manipulate it, and they can do like I don't know how to describe it. They kind of shiver their mouth.
Yeah, like if you think of like teeth chattering, like comically,
Yeah.
you know, like when they're cold.
Yeah.
Like that noise.
Sometimes they'll have increased saliva, kind of drooliness. If they're a messy eater or if they start dropping food that they don't normally do, or if you're really in tune to how they eat, sometimes you could pick up that they chew on one side of the mouth. I feel like that'd be hard to tell, but you might be able to see that. Then other times they just live with discomfort and you really don't know. So I feel like that's more common, that people will bring their dogs in and we're doing annual exam and we'll find something that really is painful, but they had no idea because they are dogs and they eat through that. So I think it's good just to have those oral health exams to look for things that could be causing sensitivity.
Yeah. I think that was, I think she got it. Job's done.
That's it.
Yeah, I would say that most of the dogs don't show pain because,
Yeah.
you know, dental disease is a chronic disease. So it's not, you know, like a broken leg where it's like they're fine and then they're not fine. It's, you know, over the long period of time, they've learned to just live with it. They don't know that their mouth's not supposed to feel like that unless you get like a tooth root abscess or something that's like an acute problem on top of a chronic problem. Then sometimes they'll get the swelling. Even if their face is swollen, they still
Yeah. I just
eat
saw him
through
the
it.
other day and he's still happy as a clam. Didn't
Yeah.
even know his face was swollen.
Right.
Yeah.
Yeah. You find the tooth lying there in the food bowl or, you know, on their bed and the tooth is just like falling out, you know. So I think a lot of times you don't recognize any oral pain, but then, you know, like all the things Dr. Schmoke said, and then maybe like dropping food and picking it back up, you know, to reposition it to the side that's not painful. If it's like a mixed diet, preferring the wet over the dry.
Odor
Sometimes.
too, probably.
Yeah.
Sometimes. Not always, but
Yeah,
sometimes.
a bad odor.
Yep.
That's like your big sign. Like that's like do something now.
I can smell your mouth from here.
Right.
Yeah.
exactly.
I mean, I think that bad breath on dogs, we just think, oh, dogs have bad breath, but like they're not really supposed to have
They're
bad
not
breath.
supposed to,
And
right.
Cats aren't supposed to have bad breath either.
right.
It's because they don't brush. Like if we never brushed and flossed, we'd have bad breath too.
Yeah.
You know,
Yeah.
That's not
I think
normal.
definitely in the annual exams too, maybe they don't have a lot of outward dental disease, but they're really uncomfortable when I just even lift up the lip and they're like shying away. They're trying to nip. Like if it's a dog, especially that's not normally doing that, that's a big thing. Honestly, there's multiple cases where I'll be like, well, the dental disease is there, but it's not terrible on the outside. And then we go get the cleaning. They have a lot of teeth pulled, and then they're like, oh my gosh, he's doing great. He's happy and eating great. And I'm like, oh,
Yeah.
great. Glad we did that,
Right.
So it's just so variable, like what you find and what you have to remove. And
yeah, I think that's usually the biggest concern is people are like, well, how's my dog going to eat without the teeth? And it's always, they eat better without the teeth than with the teeth because the pain is gone.
Mm-hmm.
You know, It's pretty amazing.
Same thing with cats too.
Yeah.
Because I mean, cats will just keep the
Dry food and everything. No
Yep.
teeth.
yeah.
I mean, their
Down the
teeth
hatch.
aren't designed to chew the kibble anyways. Their teeth are designed for like shearing and tearing. The kibble is how
Pieces.
we feed them.
Right.
You hear it like them moving it around in their mouth, but they're not actually really chewing it because they want
Hence,
to
when
chew
they
it.
vomit, it's the
Whole
kibble.
kibble.
Exactly, where you can just like spread it out, dry it out, throw it back in the bowl.
There you go.
Yeah, there you go.
Next meal ready.
Exactly, next meal. Yeah. What do you guys think are some of the reasons why people? So, go back to like some of the stuff that we were talking about at the last doctor's meeting in terms of, there's a high percentage of pets over the age of 3, like basically dental disease is present after the age of 3, and like a huge percentage of pets.
Yeah.
It's like,
I cannot remember the number. I actually just read it yesterday or today, but I can't remember the number. But it's pretty large for them to be in stage 1 by the age 3, which is gingivitis, which is the first stage of periodontal disease. Like if you have gingivitis, you would go to the dentist and they would say, you need to really be flossing every day and come back in 6 months.
right.
After your cleaning and stuff. So, and I would say not just a high percentage, but most dogs have stage 1 by the time they're 3. And that's when the first cleaning is recommended.
And what happened when they see the plaque on the tooth? What is that usually an indication of? Like once they see tartar and like plaque building up on the tooth, is that an indication that they've got some more advanced disease, or is it just
No,
you
we
don't
don't
know?
really have to use tartar to stage it. It's more based on like gum tissue and bone tissue, like the health of that. Wouldn't you agree? Like the tartar, we use it as like a guide because we can see that, but it's not part of the staging of your periodontal disease.
So what are the stages of?
Do you want me to do it? You want to
Sure.
do it? Don't let me steal the show. I'm not going to talk all day. I'm an enthusiast. So, I mean, there's stage. Love those too. There's stage 0, which is, no tartar, no gingivitis. And
You were
stage-
just born.
Yes. Yeah. You're like just getting your adult teeth in. You're age 1. And then there's stage 1, which is just gingivitis. And then there's stage 2, and then gingivitis is there the rest of the time once you get it. And then stage 2 is determined by the degree of bone loss in your periodontal disease. So if there's 0 to 25% of bone loss along the tooth root, that would be a stage 2. Stage 3 is 25 to 50% of the bone along like the tooth root. So now like when you're looking and you're lifting the lip, a lot of times you'll see that tartar going up into the gum line. Well, the tartar can only go up on the gum if there's no gum there. So you know that you're having a lot of bone loss. And then stage 4 is 50% or greater.
And that you
loss.
determine by radiographs,
Yes.
the bone loss.
Yeah. I mean, unless like,
We got to get on a TED Talk now.
yeah, about the radiographs.
Yes, radiographs, they're needed, but that's also part of our procedure. Like we don't just go in and clean the teeth and polish them like we talked about.
Yeah.
I've been having some pushback and stuff, but I've been like, it's very important that people realize we don't just go in there and clean teeth and wake them up. We do the x-rays.
Right.
So then these lovely ladies can look at them and decide like how severe it is, because you can't always see on the outside.
Yeah.
Yeah. I would say
Thank you
most
for
of the
listening.
time you can't see. Right?
Yeah.
Isn't that what they say? I don't know what they say. Majority of the dental diseases.
Below.
Below
Yeah.
the gum line.
What you can't see. Unless it's so severe and like the tartar is chipped off.
can
and
actually see
can
the
see the
roots.
roots and like the little,
Coming
like,
out.
yeah,
Yeah.
like where they attach on and all that.
Harrison,
then
do you see any
that's
pictures?
pretty
Google
bad.
pictures for canine periodontal disease.
Yeah.
So gross. I was working on that little sheet, where I was like, oh, I'm going to make a sheet and, for the rooms and stuff.
Yeah.
And I'm like, ooh, it's-
Yeah, it's not pretty. So there we go.
Okay. That's some significant gingivitis. Ooh.
Where's the
What's going
chart?
on
See
there?
that chart in the middle, Harrison, right there that says.
yeah, that one shows all the little
Yeah.
stages. The top
Stages.
is dog and the bottom is cat.
Can
Because
you
we can't
zoom in
forget our
on that?
cats either.
There you go.
Yep.
Yeah, not good.
Not.
Although I feel like cats present very differently than dogs. Cats will get some tartar, but they really get gingivitis and inflammation in their mouth more so than dogs do.
Yeah.
That's
So,
usually the percentage.
say we have an older patient. So it's recommended that we just routinely clean dogs' teeth. And one of the questions we always get is, oh, it's just so expensive.
Yeah.
And so I think to your point of,
Yeah.
it's not just, a scaling. Of course, we have to immobilize the dog in order to be able to examine all the surfaces of the teeth.
Yeah.
But then also we take the x-rays of the teeth, and then you have enthusiasts / very well educated individuals reading the x-rays and then making determinations on whether or not the health of the tooth is,
Yeah.
Okay.
I mean, we also examine the mouth. We have a little probe and we, probe the pockets around all the teeth. And, so it does take time, and then you're looking at the tongue, you're looking at the cheeks, you're looking, like what your dentist does.
Yeah, it's a complete oral exam.
Yeah, a complete oral. Yeah,
and then when you do extract teeth, it's a surgical procedure because you have to cut into the gum, take away bone, and then suture it back up. So it's just like, I mean, obviously it's not like going into the abdomen, but it's still a surgery, which I think sometimes it's easy to forget. We don't tie a little string to it and just yank it.
Shut the door.
Yeah, shut the door. Yeah, exactly.
I mean, sometimes you can probably with some of the teeth you see, but
Stage 4
usually that's not, usually you're not that lucky to do it surgically.
So to answer Becky's question, what do you do if you're a senior pet and your pet has periodontal disease? Or now her question might be slightly different because she thinks that
I think we could answer it
tooth
in two
sensitivity.
ways.
Do you know what I'm saying? Versus
I feel like we could answer it 2 ways. One, you could say, well, age is not a disease.
right.
So as long as your pet doesn't have other, diseases going on that would prevent it from anesthesia, then maybe doing a dental would be your best bet for the dog to give them pain-free eating and treats. Or if, anesthesia isn't possible, then I would say probably something soft you would want.
Yeah.
Treat-wise, no hard kibble.
What are your thoughts on the pulse therapy antibiotics if they can't undergo anesthesia?
Yeah, if you can't, then sometimes that's all you can do, just knowing that you're just keeping that infection under control.
A Band-Aid.
Yeah, you're just treating those abscesses. You're not treating anything
The pain
else.
associated with
Yeah. So you're just treating abscess pain.
Where does the pain come from most of the time with dental disease? Like you were talking about your case where there was a break in the enamel and then, but where is it just the gingiva that's causing most of the pain? Is it actually bone pain and the tooth roots causing pain? All of it?
I think all of it. I think you could see pain from the inflammation. If there's a fracture, you could see pain from, pulp exposure where the nerve actually lives inside the tooth. Or if there's an abscess, then that's pain within your jaw bone. I've never had a tooth root abscess, but people say it's
People say it's horrible.
Yeah.
I had a
And
guy in
dogs,
the clinic.
live with that.
Yeah, I had a guy in the clinic, and he's like, "I gotta get some antibiotics. I've got an abscess, and I'm going to and he was miserable.
Yeah.
And I'm like, "Oh wow,
So I think it's pretty
uncomfortable."
But dogs can't say "Oh man, that really hurts." They're just like, "Oh hey, you're home." Hi.
Yeah,
because dogs
but
are dogs.
I do agree. One of you guys said how much different they act after you take care of.
Oh my gosh,
you find a problem.
Yeah.
And then you take care of it, and then the difference, they're picking up these toys, or they used to do this, and now, and they didn't for so long. I thought it was just because they were getting older, and then it's fascinating.
Yeah.
Yep.
Very cool.
Yeah.
That's the best part about it. So you can fix problems. One of the few things I feel like you can start, finish, done.
Yeah.
Better.
Yeah, exactly.
Yeah.
Smoke, you have anything else to add?
I don't know if you guys have heard of the anesthesia-free cleanings, but I think it's important to talk about why we do dentals under anesthesia. They are out there, and some people will come in and say, well, why can't I just take my dog and have it basically all that tartar that you see, it's kind of just picked off. And some dogs will allow it, some dogs won't. But I think everything we're talking about requires anesthesia. So they wouldn't tolerate us taking x-rays unless they were under anesthesia. No dog's going to lay still for that and have their mouth open and manipulated and everything. They also have to be very still for all of that. And then, like Dr. Cloud said, we probe around the teeth to look for pockets and infection and to see if the teeth are mobile. And then that will help us determine if we need to extract them. So the anesthesia-free cleanings that are out there, it's not looking at what's under the gum tissue, and a lot of times you're just prolonging the disease and not addressing anything. So,
Yeah.
That's a good point.
It'd
Yeah.
be a cosmetic procedure.
Mhm. Yeah.
Just making the teeth look white.
Look better.
Yeah. And maybe that's all the dog needs, but I mean, you don't know if there's a problem unless you make sure you're diagnosing.
And I think I was
not a problem.
on on one of the websites that I look at. It's a workplace website, and one of the board specialists, the dentistry, because I was actually looking at the loops. She had a recommendation for loops, and so I was like, I texted her in Ignite and was like, "Where'd you find your loops or whatever?" And she was texting me back. Anyway,
for tiny head people.
Yeah, exactly. And so she said that the World Small Animal Association, WSA, they say now that it's required, like to do dentistry properly, it's required to have dental x-ray.
Yeah.
You have to have proper magnification, proper light, dental x-ray. Those are the three things, digital x-ray. Those are the three things that are required to be able to.
Makes sense.
Yeah. And so I think a lot of times too, I think people are comparing apples to oranges.
Yeah.
You know, when they're coming from, at least for us, it seems like sometimes when we have people coming from other practices or other parts of the country or or maybe even never having a dental.
Yeah.
The x-rays are really the whole key to everything. You can't extract a tooth and know necessarily that you got the entire tooth.
Right.
That's what I want to say. I get a lot of pushback about our process because maybe they've gone to another clinic and teeth have come out, but who's to say they did an x-ray to make sure the whole thing came out? Like that is a very common thing, especially before they established as x-rays were, you know,
I'm sure it was all the time before we ever, because back in the day, that wasn't a thing that we could do financially to buy the equipment. Like you couldn't, it wasn't feasible. They didn't have the equipment such that you could, you know, that it was in every practice, you know, that it made sense to be able to buy it.
And they were like, first it was like the film, so you had to like dip in the thing, and that's so time consuming.
Oh
and
gosh,
I mean, it just wasn't practical, to do it that way. But now it is.
It's important because you don't want to leave anything behind.
Yeah, I was going to say leaving roots behind
infection again.
Yeah, is a problem.
So, it's very important.
Yeah, very cool.
We do have a method to our madness.
We do.
But I would say sometimes I think the miscommunication, or I don't know if that's the right word, maybe the misunderstanding is because maybe we're not as good at communicating the value, because I think we so often talk about it either amongst ourselves or it's just kind of like ingrained in your head that you think the people are on the same page as you.
Right.
Yeah. You know, and so it's like you forget that, oh my gosh, they might not know that we're doing this and this and this. Like when we had the doctor's meeting and you were talking about the difference between a hygienist and this.
Right.
It's like, oh, you know, that's a great way of explaining
I use that
the difference.
every time now that I talk to someone. I'm like,
it's not just a cleaning,
you
know. And also you have to think that, you know, I think unfortunately most of the time when we're doing a dental on a dog, they're already into stage 2 and 3 by the time it's recognized enough to say, oh, we should probably clean the teeth. So I would say most of the time we are doing some extractions by that point, because what we see if we're seeing it at the gum, then what's happening on the x-ray is even more progressed than what we're seeing on the gum.
On the gum.
Yeah. So I think that, you know, it does sometimes catch people by, you know, like, I didn't think we were going to have any extractions. And it's, you know, because we're doing the dog at the age of 8. You know?
Right.
Yeah.
Well, and I did, you know, Carla knows because I did the experiment on my own dog who was a dachshund who was known for periodontal disease. So we started at like, I don't know what age. I mean, and we cleaned his teeth every 9 to 10 months.
Yeah.
Oh,
and
wow.
We did a long time with no extractions.
A long time.
Yeah.
I want to think it might have been 11.
Yeah.
Like 3 years ago. I think
it was pretty recent we started, and it was just like the little molars in the back, and it wasn't anything.
Yeah. But I mean, and I do nothing.
fascinating.
I hate to admit this, but I do nothing. I don't practice veterinary medicine at my house.
Yeah.
So like, that's a bad thing.
It's hard.
I'm a bad owner. People are like, how do you work in the field and you're such a crappy owner?
Because you get home, you're tired. It's been a long day.
I had this discussion with my animals. I was like, none of you are allowed to have any problems because I don't do anything when I come home. I'm sorry.
Right. Check out.
Somebody
mentally.
ate like an entire bag of marshmallows or spilled flour and sugar when Sam was watching the dogs. I was like, I don't know. Hope you guys don't get sick. I'm like, I'm at work. It seems like I'm at the day.
They'll be fine.
They'll be fine.
They'll be fine.
Exactly. Oh gosh.
Yeah.
Anyway, so yeah, Lance made it a really long time.
That's fascinating.
But I mean, that was cleaning his teeth every 9 months.
Yeah.
It wasn't even every year. It was like every 9 months.
It was like every 9 to 10 months because I would be like, "Is it time, Carla?" And she'd be like, "I think we would lose track of time, and we'd think it's been a year or 14 months, and we'd look and it'd be like 9 months."
Yeah.
Oh my god.
Yeah. Oh, she's like, "Bring him in." I was like, "Okay."
Yeah.
Yep.
It paid off though, because you kept your
did.
teeth for 11 years.
Yep. He kept his teeth a long time. So he's got other problems now. So we didn't clean his teeth. We just brought him in recently and we're like, nope, skip that.
Oh,
So anyway,
poor Lance.
anybody have anything else to add before we?
I think this was great. There's so much pushback and questions about dentals, I feel like, and it gets a
I can
little
talk about
frustrating.
teeth all day.
Yeah.
So if anybody out there has any questions,
For sure. Call us, email.
Yeah.
We're happy. They're happy
I'd love to talk about teeth.
We
to
don't
discuss. Yes.
Something soft.
Oh,
Was that
yes.
my
That was
answer?
the, yep. Carlos said something
Yeah.
soft.
Yeah.
They
soft.
do make some treats that are like the CED. I feel like they had like a brand that wasn't like a chew.
the tartar shield ones.
Yeah, they're
Those? No, you know.
they fall apart.
Purina has one that I give my dogs, and it's not like a rawhide really hard. Like they can bite into it and have a little resistance, but then it softens and they eat it within
They
like
eat
a
it
minute.
over time.
Yeah. No, it's like quick. It's
Oh,
like
quick.
a quick treat.
Okay.
But it's not, yeah. I don't know.
I would also
For a man
say
soft.
because her dog is exceptionally picky. So it's like finger brushing or,
Yeah.
you know, and we would be remiss without mentioning the Veterinary Oral Health Council.
Oh, God.
Yeah.
VOHC, love them.
I mean, they do have a list of like tartar shields on there, and then some of the rawhides. And
Mm-hmm.
I think they do Healthy Mouth. Healthy Mouth, I think, is the water additive that they have tested and recommend.
So yeah, they're an independent council. They don't work for any one company. They just test these products.
And they're just testing to say that what is on the label, what the product is claiming to do,
Actually does it.
Yes, that they've
Yeah.
done some studies to show that it actually does what it says.
yeah.
great
So,
piece of information.
yeah. So
Love it.
check out their website too.
Okay.
Okay.
Outro. Okay, I'll go.
Okay.
Thank you so much for tuning into another episode of the Veterinary Roundtable. Remember, send in those questions and be sure to follow us on all social media platforms at All Star Veterinary Clinic. If you enjoyed this episode or a previous episode, leave us a review on your podcast provider of choice. We'll see you in a few weeks for the next episode of the Veterinary Roundtable.
Thanks, guys. Thanks for joining us. Bye, everybody.